Hi, this is Dr. Doreste with the Cranial Release Technique. Wanted to come back to you today with a different sort of a video. It's something probably you've never heard of or thought of, and it's a concept that we talk about in the world of Cranial Release Technique, and that is about nutrition. Now, before you say, wait a minute, there's a million videos on YouTube about nutrition, and I'm aware of that. I'm not going to tell you what to eat. I am going to tell you how nutrition is improved with the cranial release technique. And that still may not make any sense to you right now. So let's just dive into that a little bit. Regardless of the type of diet that you eat, whatever it is that you put into your mouth, fruits, vegetables, grains, meat, chicken, fish, eggs, whatever it is you put in your mouth, you chew it, you swallow it. Hopefully you say, gee, that was great, and you forget about it. That's what we call extrinsic nutrition. That's what you put into your body from outside, swallowed it, and left it alone. What I want to speak about is what's called intrinsic nutrition. How well does your body take that food that's now passing down the esophagus to the stomach? How well can your body, how efficiently can your body take that food, break it up, mix it with the different chemicals, absorb it, and extract the maximum amount of nutrition from that food, which is what you're trying to do, because you certainly don't want it just to pass through you. You want to extract all the nutrients, the vitamins, the minerals, the amino acids, everything that's in there that you want to get out of it, and let the waste go down the drain, so to speak. And the reason why this has something to do, and really everything to do, with the cranial release technique is that once you swallow that food and you forget about it, now you're into the world of the autonomic nervous system, the involuntary nervous system. So we're not aware of it. We don't know. You can't tell me how to physically break down your food in your body, but thank God our body knows. So, what does this have to do with the cranial release technique? Again, in other videos, we've spoken about the autonomic nervous system, the involuntary nervous system within your body, which is really broken down into two sides. We have the fight or flight mechanism, the nervous system that turns on when you're under threat, when you're in a danger, when you've got to run towards something, run away from something, act quick, act without thinking, just reflexly save someone's life, get your car out of the way of something that's coming, whatever it happens to be. That's the sympathetic nervous system. And then in theory, once that's over and you calm back down, you should shift back now to the parasympathetic nervous system, the heal, repair system, the side of the relaxation side of the autonomic nervous system. So you sit down, you eat a meal, you swallow it, you're sitting there saying, that tasted good. Now, in theory, you shift and your parasympathetic nervous system takes over. That's the side that's responsible for digestion. That's the side of the nervous system that's responsible for ultimate, maximum efficiency of breaking down those products that you put in your mouth, those food chemicals, and extracting the nutrition, and then pumping those out to your cells. So, if the cranial bones have shifted, if you're stuck in a sympathetic mode, fight or flight, and now you sit down and eat, and now you swallow your food, and now you start to digest your food, and you're stuck in a sympathetic mode, yes, you will still get some digestion, but it will not be as efficient as if you could shift back to the parasympathetic. And kind of the way that I think of it is the cranial release technique opens the doorway and lets the nervous system shift from sympathetic as needed to parasympathetic as needed. You need both. As I've said in other videos, it's sort of like driving your car. You need the gas pedal and you need the brake. You need them both in harmony to drive from here to the supermarket and come back. To digest your food, you need to do the same thing. To sleep properly, you need to do the same thing. To do your job, you need to do the same thing. You always are shifting sympathetic, parasympathetic, based on your need at this moment, at this day, wherever you are on the planet right now. In my experience, when you go and take a look in the mirror and you see that one of your eyes is lower and one of the eyes is smaller, the ears maybe are rotated, or one ear is lower or higher than the other, there's a very good chance that that doorway from sympathetic to parasympathetic is now blocked. You'll still shift. It'll probably take you longer. It won't be as efficient. Your brain and nervous system won't be as effective. And again, the only reason why we're talking about this is that the central nervous system, the brain and spinal cord, controls and coordinates all functions of the body. That's right out of Gray's Anatomy. That every doctor studies from that same book. So the next time you're sitting down for a meal and you finish your meal, you remember Grandma always told you, well, after you finish your meal, don't go swimming, you'll get a cramp, or don't go for a run. You got to let that sit, let that digest, let the body do what it needs to do. And really, the foundational basis of that is that you're letting your body shift to the parasympathetic nervous system. It's the parasympathetic that's doing the healing, the resting, the digesting, all the things that we need to rebuild the body. And then the sympathetic is when you have to hit the pedal to the metal, do what you have to do it with intensity. Normal, natural, we want you to be able to shift from right to left, from sympathetic to parasympathetic, also from hemispheres right to left as well. So we want the doorway open, and cranial release, in my experience, can do that for you. When you get a moment, if you like this video, subscribe please. Also, visit the website at cranialrelease.com. There's a few things you can do there. You can order a free report. You can take a look and see if there's a practitioner in your area, the Find a Practitioner button. And if you are a practitioner, or if you are watching this and you go to a chiropractor or a massage therapist or an acupuncturist or a holistic dentist or whoever you see, feel free to share this video and share my channel with them so that maybe they would be interested in learning the technique. And you can learn the technique at the website, cranialrelease.com. You just click on the online training button, and as I like to say, away we go, in the words of the great one, Jackie Gleason. And I will see you over on the other websites, and I will be the one leading you exactly from every aspect of the cranial release technique, from how do you do it, why do you do it, when do you do it, how do you know if you did it right, what tests do you do to determine if you did it right, how do you educate patients about it, how do you take this 1 minute, very simple but very specific, very precise technique that has to be done just right. When it's done right, the cranium opens and you restore the normal primary respiratory mechanism. This is normal, this is natural, this is supposed to be happening in all of us. When the cranial bones shift out of their normal alignment from whatever causes, stresses, falls, accidents, sporting injuries, exercises, chemical stresses, physical stresses, emotional stresses, that impedes this movement. When that movement is impeded, there is now a weakness throughout the entire body, regardless of whether you have symptoms or not, okay? This is probably the most important point. But doc, I feel great. Yeah, that doesn't really matter to me. Yeah, I want you to feel good. That's great. But I want your body to function optimally. This is all about optimal function. Cranialrelease.com. Dr. Doreste saying adios, my friends. Hope to see you down the road. See you in the training program. Cranialrelease.com, online training. Adios, my friends. 10-4. Goodbye.